Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Our topic for today is how to promote longevity and whether using nutritional supplements to promote growth hormone and IGF1 levels will promote longevity. Our guest is Dr. Bruce Fong, who's a doctor of osteopathy, a homeopathic practitioner, and he's the medical director at Sierra Integrative Medical Center, where he uses alternative therapies for treating immune-related diseases like Lyme disease, mold, etc. Dr. Fong, thank you so much for joining us today.
Thanks, Ben. I really appreciate the opportunity to be on the show today, and just looking forward to a great time with you.
Sounds good. So, Dr. Fong, what are some of the keys to longevity? And for that matter, how do we measure longevity?
You know, it's an interesting topic because longevity is a term that can even come from really ancient, even ancient Chinese texts or whatever. It's not only the prolongation of our lifespan, but a prolongation of the quality of our lifespan. It's not just about how many years you live, it's about how you live them well. And the ancient Chinese had a lot of different things that they could do for that, but one of the most critical ones was actually using deer antler. And we can, as we progress in our discussion, I'll explain that. But even in traditional Chinese medicine, where you go to the herbalist and stuff like that, they've always added deer antler typically to the mix of the different powders. I don't know how familiar you are with or the listeners are, but I grew up in San Francisco. I'm a Chinese American born here, but we grew up. I go to San Francisco in the Chinatown, and I hated that smell back then. I'm going to be honest with you. That's some really funky smells when you go in the places, and they have all kinds of things all dried out in little containers. It's kind of freaky to a kid to walk in there. But now that I understand those things and I have a better appreciation of those things, what the herbalist would always do is that, hey, you go home to him like your regular doctor, and you kind of go, hey, I've got like a cold or whatever, and they grab the various herbs that or the other freeze-dried preparations that they had, or preserved preparations, I say, that they had, and always it seemed like they would take the deer antler, which would be in a big glass enclosure, pull it out, and scrape the end of the antler into the mix to create some kind of a powder. And then they use the old mortar and pestle to really grind everything together, put it in a little satchel and say, hey, make a tea out of this, or sprinkle this on your food, whatever. And that's how the things went. And to this day, deer antler is probably the second most used thing in traditional Chinese medicine, short of ginseng. So that's how involved it is. And there are ancient Chinese texts that talk about this, going all the way back almost 3,000 years, about it helps with healing of wounds. It helps with building the body back up after sickness. It helps to promote virility, helps to promote vitality, it helps to promote the continued strength in the body, et cetera, et cetera. The list kind of goes on. And as we, like I said, we probably want to further discuss that as we go forward. But I just wanted to give you a historic background of what longevity really is about. Healthy aging, I guess, is the short answer. Sorry, I talked way too much on that one.
Yeah, no, that's good. So we'll get to the deer antler in a minute. I'd like to focus a little more on some of the concepts of longevity. Do you measure longevity in your practice? Have you used like telomere length or DNA methylation?
Well, I'm very familiar with the telomere concepts. We use a lot of things actually for healthy aging in our practice. We're, to give me my background, I'm an internal medicine doctor. I went through a 3-year residency, and I'm traditionally trained as an osteopathic physician. But before that, this is kind of backwards, but before that, I actually worked at various levels at my parents' integrative clinic here in Reno, Nevada. Yeah, I mean, I started out as the guy that took the garbage out, but but I worked my way all the way to the top, I guess, And one of the coolest jobs in undergrad college, by the way, I got to be a hyperbaric oxygen tech. And
Okay.
basically, you get the patients up to pressure, make sure they're okay, and then you have to sit there about 90 minutes with a patient under pressure. Perfect time to study and read, and just occasionally pick up the phone, say, hey, you good, you're doing good, whatever. But I grew up in this form of medicine, and as I grew and I understood things, these days we have different all kinds of markers. You mentioned really good stuff about the telomeres, and in case the listeners don't remember what that is, your DNA has little snippets on the end that every time you replicate your DNA, you lose a little bit of that DNA. So those are the things called telomeres, and there's an enzyme that cleaves off that little bit each time, and that's what we think is responsible for aging. And so there are things that you can do to try to limit something called telomerase, or the actual enzyme that snips the ends off. So those are really cool things. We also do things that people are probably more familiar with as well. We measure hormone levels, and we utilize a more integrative technique to both evaluate those levels. We don't just go by laboratory values, which if you think about it, in the laboratories, you do so many standard deviations above and beyond. But really, at the end of the day, most laboratory values look at maybe like 80% of the population. So about 1 in 5 of us sometimes doesn't really fit that mold. Plus, we have what are called age normals in hormone values. And, okay, great. I'm 53 years old. This is normal for me for such and such, but I don't feel good. Why don't I feel good? Because I want to feel like I'm back when I'm in my 20s. And so the same thing, and many of you probably understand that that's where we're talking traditional hormones like testosterone, estrogen, progesterone, whatever. And the other thing, though, is this moving into the discussion of where Deer Antler fits in. We have human growth hormone. We have human growth hormone that stays at high levels, then gradually starts coming down, especially after we're in our 30s or so. Everybody's already heard about that point, and when you hit your 30s, your metabolism slows down, you get fatter or whatever. Well, I mean, there's actually a shift in your hormones, and a shift in things like human growth hormone. Now, human growth hormone, when we make it in our body, the primary thing that comes from it, where it's converted in stimulates the liver to produce, is something called somatomedin-1. Somatomedin C, the letter C. And that really translates into insulin-like growth factor 1, or IGF1. It's the main motivator that repairs things in our body. When we overwork ourselves, we work out too hard, it helps to rebuild those tissues really quick, and it allows us to put on muscle mass if we're working out, et cetera, et cetera. It also regulates hormones, it regulates inflammation in the body, helps basically build us up and to maintain us. Once we hit the age of 30, like I said, those levels start to go down. So we don't have as much human growth hormone, but also as a result, that stimulation to make IGF1 starts to go down. And that's another way to think about aging. It's not just about the years and the fact that we look more wrinkly, or the fact that we have white hair or whatever. It's about how we can maintain our bodies. And really, most people before the age of 30 typically don't have a lot of chronic medical conditions. So looking at this from an internist standpoint, we start to screen for things probably in that decade of life. And then as we get older, we start to notice things that in the body, like increasing risk for cardiovascular disease, for instance, as we move forward. A lot of this can be directly correlated to the loss of these growth factors in the body, because we can't maintain ourselves very well, because we can't continue to fight off the vestiges of our toxic environment. We can't keep ourselves as healthy and keep ourselves as optimal as we want.
Now, I've been tracking the longevity research via going to seminars and listening to talks and reading books and articles. And I would say 15, 20 years ago, there was a big push for using hormones, using growth hormone. And there were quite a number of clinics that sprung up that were actually focused on using human growth hormone. And there were issues with the FDA shutting some of them down and making it difficult. And what do you think about that whole concept of actually using human growth hormone as a longevity concept?
So the use of human growth hormone has actually been well proven to be in the strictest definition, one of the best things you could do for longevity. But there's two big factors here. Human growth hormone is one, extremely expensive. Two, these days to get your insurance to pay for something like that, you would essentially have to go to an endocrinologist to be evaluated and show by the strict guidelines of the endocrinologist to say you actually need this. The actual growth hormone levels are low, your IGF levels have to be low, et cetera, et cetera. And you got to meet all these criteria.
Even if the insurance is not going to cover it, it's not easy for physicians to prescribe growth hormone, right? Isn't it tightly controlled?
Yeah, they again with even outside the insurance realm, you can actually prescribe it, but again, you may get some feedback from a pharmacist or somebody else. And also, like I said, the cost is fairly prohibitive. I mean, you're talking like thousands of dollars in a month. And so that's not an easy thing to do. So what else can we do for that really is shift to what the growth hormone produces in our body. And one of the things that I mentioned earlier was somatomedin C, or IGF1, is the primary motivator of this particular, of the benefits of the growth hormone. Again, healthy aging, like all the other benefits I mentioned earlier, but it's really the IGF1 is the main factor for that.
Now, interestingly, the longevity, anti-aging research and a lot of the focus that I've seen from going to seminars now has shifted from trying to promote growth, trying to maintain muscle, more towards trying to prevent cancer, trying to prevent some of these other chronic diseases. And so there's been a lot of discussion that higher levels of IGF-1 are actually associated with decreases in longevity. We have higher levels of IGF-1 potentially increasing cancer risk. And Walter Longo has been very outspoken on this. He published a review on IGF-1 levels and longevity, and consequently, he's recommended a lower protein, more vegetarian style diet to promote lower IGF-1 levels. And one of the factors that's often brought up when discussions of whether or not IGF-1 is good or bad for longevity is the example of the Laron dwarfs, which are, there's approximately 300 of them. Most of them live in Ecuador. And while they have normal growth hormone levels, they don't have the receptors to bind the growth hormone. And consequently, they can't make IGF-1. And they seem to be protected against cancer and diabetes, and they tend to live a longer life. And on the other hand, many of the larger people, like professional bodybuilders, we've seen a whole series of professional bodybuilders the last couple of years die early. Professional football players are renowned to have a shorter lifespan. Now, there could be many reasons for that, just being bigger or potentially having higher IGF-1 levels hasn't really been shown. But we also have examples of people with acromegaly, or what are called giants, like the professional wrestler Andre the Giant, who died at age 46. So there is this concept that higher IGF-1 levels are bad for longevity.
So there's a lot of points in that question. So first off, so let's start with the Ecuadorian dwarf guys. They are actually genetically set up to have that lifestyle. They're genetically staying in a geographically isolated area. We've found multiple populations throughout the world that when they're in the right conditions at the right times in the right places, they're basically, their cardiovascular disease risk is almost zero. They found villages in China and I believe in Japan that the people's LDL levels, so here they have a different argument, but for the same reason, that these folks' LDL levels, the low density lipids, are the bad things that you're trying to correct when you take statins and all those things, their LDL levels are below 40. And so the conclusion of this study that was said is that, and since these people have no cardiovascular disease risk, essentially, It was a conclusion that was drawn from this study a few years ago that said that we should actually try to get all of our LDL levels below 40 or whatever it was. And so in other words, they were pushing for a goal of 39 or less for the LDL. And
Right.
as many of you know, if you're below 100, your doctor's starting to think about putting you on a statin. Well, again, you're talking about genetics and then trying to get people who are not in that genetic makeup to force them to go into something else. And that doesn't always work really well. In other words, if we put across the population, everybody have your LDL below 39, well, the only way to get there is to use something like a statin. And of course, we don't need to get into that, but there's a high side effect profile with a lot of the statins.
Especially if you have to use a higher dosage, especially
Exactly.
if you have to start adding a second medication to get it that low.
Right. So as a corollary, back to the Ecuadorian, I hate to use them, the word dwarf, but the whole point is that they're set up and they've over, the thousands of years that they've been there, they've adapted to their environment. They've adapted to that lifestyle. So yeah, they're going to have much better, in other words, they've been optimized and they're in a place that's really isolated. I mean, I think your listening population can understand that we're in kind of a bad world these days. Things are too polluted. Things are, we're subjected to a lot of things that probably affect our bodies in a negative way. These guys probably don't, and they've adapted that environment that they live in. There have been repeated studies showing that when you take somebody out of those perfect situations, even I think it was like ethnic studies that showed folks in Japan who had these really long lives, once they left Japan and came to the United States, changed their diet, came to a different environment, they quickly slumped off and went right back into what the average of everybody else was, if not less. And so there's plenty of evidence to say that, these perfect niche situations, when you remove the person from that alone could actually throw it off. So to put the conclusion that it's just about, IGF, because the IGF was probably the resultant or the main factor that there is dwarfism, and to say that there's a lower risk for cardiovascular disease or whatever else, I personally would question those conclusions. I think that there's a lot of different things we need to think about. So the other end of the spectrum, big athletes. We talked about this, quite a few times. But the folks that are really big and they push themselves really hard, the folks you always hear about, unfortunately, having a bad outcome, they were the ones that really pushed themselves above and beyond what their body can handle. And I think that one of the critical things as I get into what this particular IGF-1 product from Nutronics Labs is, there's a big difference between that and actually taking pure IGF-1. Pure IGF-1, there is definitely a risk because it stimulates growth across the board, like you were saying. But the Deer Antler Velvet product, that is what Nutronics Labs IGF-1 Plus is very different. So let's talk about that a little bit. Every year, in case you guys
hang on, let's just put that off for a few more minutes. Sure. I know you want to get to that, but I just want to have a little more discussion. I think, the concept about longevity and IGF-1 centers on, we have two balancing factors that we would ideally like to have happen as we get older is loss of muscle, sarcopenia, loss of bone, osteoporosis, loss of immune system function, what we call thymus involution. These are factors that commonly occur when you have less growth factors in the body, and these are negative for longevity. People fall, break a hip, a lot of the consequences of weak muscles, weak bones, a weaker immune system is very, very negative. On the other hand, things that stimulate growth may stimulate growth of cancer. So I think that there's some sort of a balance that needs to be struck here as we go through life to balance those out. And I suspect that eventually we'll come to the conclusion that there's an ideal range for things like IGF-1, not just that it should be lower or higher.
Right. So everything's about a balance. Again, the Deer Antler Velvet is actually the center of all this. So again, I want to emphasize to the viewers, this is not pure IGF-1. This is a complete growth matrix. So really quickly, in case you don't know it, deer lose their antlers every year. And then in the springtime, they actually have a rapid growth of these antlers. It takes about 110 days, and they have these full racks that, people can, when they hunt the deer, they sometimes treasure the racks and things like that. But really, if you actually understand that, I mean, think about that. Within 110 days, you go from little nubs to growing these full big racks of antlers. So there's definitely something there that has rapid growth, but a controlled rapid growth. So what was found is if you harvest the deer antler about halfway through the cycle, about 55 days or whatever, ideally, the inside of the antler is this gelatinous sort of gooey matrix that's brownish in color. And when you extract it and you cold press it, you produce this brown liquid. And when you analyze it, it's primarily IGF-1, but there's a whole myriad of other growth factors. There are other things like transforming growth factors, morphogenic growth factors that actually check the IGF-1 and to help maintain healthy and specifically desired growth and to exclude any type of abnormal growth. So again, this is a complete matrix. So again, I don't make any secrets about it. I'm a Christian, and I do believe that God created a really good system here. And he built really a perfect system to grow stuff with, and he adds the checks and balances. That's why this product, being a pure extract of the deer antler velvet, and then being brought into the body, gives you a complete growth matrix. So then there's your balance. There's things that help to grow, and there's other things that also check abnormal growth. So that's the critical part. And then, of course, there's other things in here. There's IGF-2, there's neurotropins, things that help grow nerves, help to grow bone, grow connective tissue. And the biggest thing that the main matrix, it's collagen. So there's a lot of things we can discuss here, which do add to that discussion you just said about maintaining all the various hormone levels, the growth factors, helping the body to maintain itself, reducing inflammation, which could be dangerous to you in a long-term basis. The bottom line is this is a complete growth matrix, which is there to help establish and to maintain that healthy growth. So I'll let you take our direction next because there's a lot to talk about there.
Well, I've seen deer antler supplements on the market used in the bodybuilding context and in the testosterone raising supplements. Does deer antler raise testosterone levels?
Well, that's a very good question. So deer antler, specifically through the IGF-1 mechanism, increases luteinizing hormone, which is the stimulating factor that actually creates a increased production of testosterone. And it also helps to build the other hormones as well. But again, that is a natural stimulation as opposed to, say, taking ridiculous amounts of testosterone, which is where some of those guys you mentioned who had passed away early, they were doing things like that. And, when you push your body, and again, remember the emphasis is that this is a natural product. This is a balanced product. When you try to use something out of balance, like IGF-1 by itself or testosterone in excess, which, by the way, have resulted now in that for the last decade and a half, that testosterone is now a controlled substance, was one of the reasons for it was people were abusing it. But the point is, when you use this natural growth matrix, it is interacting with the existing systems in your body. In other words, it's completely compatible with your body. And your body has its own checks and balances of how much it's going to be stimulated and to be able to make. So in essence, the deer antler product, or the IGF-1 plus product from Neutronics Labs, helps you to be, and forgive me, U.S. Army, I'm not trying to infringe on a copyright, to be the best that you can be. It maximizes your potential for healthy aging, as we've been talking about. It helps to maintain muscle mass, helps you to actually put on some muscle mass, and it helps to metabolize fat much more rapidly. So from that standpoint, it's very excellent. It helps to build various different types of muscle fibers, including the ones for endurance, as well as the ones for quick strength. So from a performance standpoint, that's there. It helps to regulate the levels of testosterone, but again, it may not be 100% enough. Again, there's so much that your body can only do when it's being stimulated, as opposed to throwing the end product in there. So
Now, it's generally thought that hormones like human growth hormone and most of the other hormones are not well absorbed if ingested orally.
exactly.
How do we know that any of the products in Deer Antler are going to actually have a therapeutic effect?
So two things I want to mention as I get into there. First, the Neutronics Labs IGF1 product is the only product I know of with Deer Antler that has been assayed by a third party to confirm that if we say there's 100,000 nanograms in the bottle, that's what's in there. And so again, we have third party assertions and studies to confirm that. But I'm glad you asked this question. You're absolutely right. All these growth factors and other products, when taken orally and just simply ingesting it, typically stomach acid and or the digestive enzymes tend to destroy them rapidly, and the absorption is not fast enough to really get there. So you're kind of playing a little bit of Russian roulette. Are you really actually getting anything? All of the IGF-1 products from Neutronics Labs actually use a liposomal delivery system. So that means it's fat-based, it allows for rapid absorption, and guess what? They don't swallow them. You put them on the tongue. And I'm sorry if I scared the listeners, because the bottom of my tongue probably doesn't look so cool there. But anyway, the bottom line is that you put it under the tongue, and it's a sublingual delivery route. People are going, why would you put it under your tongue? Well, most people have heard of people taking nitroglycerin if they have chest pain. The reason we use nitroglycerin is that it rapidly absorbs under the tongue and creates what's called the vasodilatation. Basically, it opens the blood vessels. So we need a rapid effect in case somebody's trying to have chest pain, maybe going into a heart attack. You got to get it there. And traditionally, that's what's been used. Modern medicine has kind of forgotten about the fact that under the tongue, we have a big capillary bed, which is an absorptive surface that gets things directly into the bloodstream if you have the ability to do it. Typically, the nitroglycerin gets absorbed very well. The liposomal or fat-based delivery system of the IGF-1 products actually rapidly facilitates this growth factor getting into the bloodstream. So again,
so is there scientific data are there randomized trials that actually show specific benefits of Deer Antler, and B, other people make this claim about sublingual route of absorption. Do you have data showing that your product, when ingested sublingually, actually gets into the bloodstream, has a higher absorption level than otherwise?
So it's really interesting you asked that. I actually did a small trial here at my office with my staff primarily, and we were recording things. We left the catheter in their arm, and we would actually draw blood, measuring an IGF-1 level, and very carefully labeled the tube as this is the pre-treatment level. We applied the product sublingually, and we actually checked the data from, I believe it was 15 minutes and then 30 minutes, and I believe even 45 minutes afterwards. And we showed at 15 minutes that there was a noticeable spike in the level of IGF-1, but usually by 30 minutes, it was already gone, meaning that these growth factors are rapidly taken up by the body via the bloodstream. And then those that we had in the trial that were not being given we given a placebo, they had no spike whatsoever. So again, I've got in clinical data that has that. I've seen other folks demonstrating the use of liposomal delivery systems for other products. So it truly is a very good route of entry.
But it'd be nice to have some published scientific data for that.
Yeah, I think that I know that we had a small trial, like I said. I think it might be on our website at Neutronics Labs. But again, we've if you look at a lot of the utilization of a lot of products that are sublingually, a lot of I'm also I've trained in homeopathy as well, and a lot of the products there are actually delivered sublingually, and they're meant to be delivered sublingually. Again, shooting for that capillary bed.
No, I know. I just don't think that there's much published scientific data to substantiate that concept, right?
Well, I mean, again, look at the utilization of nitroglycerin. Right. When people are utilizing, if it didn't work, we wouldn't be telling people to put it under their tongues. And
right.
That's the most rapid thing. If you swallowed, so there's two forms of nitroglycerin. For instance, the rapidly dissolving 0.4 milligrams that goes under your tongue. And then there's a pill that gives you a sustained release of nitroglycerin throughout the day for people who have angina. And so the reason you want to hit the one at the tongue, I mean, people take several, if they're having bad chest pain, they're going to try to swallow that or put half that bottle of the nitroglycerin under the tongue. And sometimes it actually helps. And the fact is that it is rapidly going into the bloodstream. And there may not be modern randomized trials for this thing, but honestly, it is a acceptable route. I mean, even looking at conventional medicine, that it is a normal route of what do you call it, ingestion or utilization of the body.
Okay, well, how about randomized trials to show Deer Antler having the effects that you're claiming?
So we have a lot of trials that are out there in regards to what specific effects like the IGF1 and the other things have. And again, the IGF1 being one of the main constituents of the Deer Antler. There have been a lot of published trials. Let's talk about performance. Let's see, I'm trying to remember the guy's name. Arkady Koltin was a Russian, maybe actually in the Soviet era. So if I misnaming that, forgive me. But he actually was an athletic. He was randomizing his control of IGF1 in the performance factors of some of their athletes, and utilizing and he's recording his randomized trials, and it clearly showed huge benefits in the endurance. I believe these were swimmers, but endurance and the muscle development in those that were receiving the IGF1 were much higher by at least 20% or more compared to those who were not receiving it. So from a performance standpoint, we're seeing that. The folks that in general have seen a lot of other performance parameters looked at through the years, and that's what generated the, I guess you would call it, the craze that you called it 15 years ago. So there's a lot of studies in the sports physiology and the other journals in that direction about how this really can show its benefits.
Is Deer Antler approved for use by Olympic athletes?
Unfortunately, anything that is considered a performance enhancer is supposed to be illegal. Now, don't take this the wrong way, but based on what I said in my little trial, the stuff disappears so quickly or so rapidly absorbed that unless somebody was taking blood like we were doing before they actually took the dose and within 15 minutes and rechecking it, you probably wouldn't be able to detect it. So again, I'll leave that to whoever wants to take that news, whatever they want. There were some very famous athletes, we'll say, in the NFL and the Major League Baseball that were reported to be using some of these products, and the major sports leagues had banned it. We went on the air to try to fight that because we didn't feel it was a dangerous enhancement thing. It was just, again, it's something, again, is a growth factor, is a stimulant in your body to produce the various things that you need. It's not adding like steroids. It's not adding testosterone, which take you probably above and beyond what your body can handle. And that's where the danger thing you were saying about the folks dying early and everything was. This is a natural stimulating product that helps you to grow better. It helps you to bring yourself out to the best that you were meant to be. Maybe, maybe even beyond what you thought you could do, but still your body can handle it. But it's not going to take you beyond that to a dangerous level and then throw you out of balance. Remember, in traditional Chinese medicine, you always talk about the yin yang, the balance of things. You don't want to push so hard in one direction, the other direction suffers. And again, this is got its own checks and balances within the product itself, and it's also checked and balanced within the body itself. So again, you get to be the best you can be, and there's basically no danger with it. In fact, in the I believe it's more than 3 decades of this product being available, there has never really been, as far as I know, any reports of people getting cancer from it, having any negative outcomes. I mean, that's really basically kind of speaks for itself. So I would put that out there for you.
Okay, so what are some of the benefits you found for patients?
So again, in our particular practice, we see a lot of patients for a lot of chronic medical issues. And a lot of times it involves a very deep history and physical. I usually spend about 90 plus minutes with my initial patients to really discover. In other words, you show up here and saying, I have chronic fatigue or I have fibromyalgia. Well, I don't stop there. I go deeper and deeper trying to figure out underlying causes for these issues.
Yeah.
And then we try to work those up properly. But a lot of times we find occult infections like Lyme disease in a good number of patients, mold and mycotoxin toxicities, heavy metal poisonings, chemical sensitivities, even food allergies all play a role in these things. And so we go there, we find our information, then we treat these patients. And then sometimes while treating them, they're going to have kind of a rough run because you're getting rid of different things from their body, especially treating infections. They can kind of wipe them out a little bit while doing that because they have what are called Herxheimer reactions at times based on some of the therapies we use. And then basically we're detoxing them the whole time. Then afterwards, we want to help them to repair things. Now that we've taken away the aggravating or the hurtful factor or the pathogen, if you will, then now is the time to enhance or encourage that body to repair itself. And I've never found anything better than the IGF1 product from Nutronics Labs to do that. And I've seen patients who recovered much more quickly after these treatments than with the product than prior than when I before.
And what is recommended dosage and length of time?
So if you're talking about my patients, I typically I can go with anything from like a 10,000 nanogram per bottle dosing, which is a spray, or I can go as high as 100,000. The ones that are, shall we say, more sedentary, maybe a little bit older, I probably start with the lower dose just to get them where they are. And I feel like if they're making gains and they want to be even better, then I can always bump them up to the bigger dose. The people who are very active or who were very active prior to getting sick, I typically start them at about 100,000 nanogram per bottle dosing. And that allows them to more rapidly repair. And because they're trying to become more active again, it helps to mitigate the sort of stress factors about trying to work out sooner or trying to get back in the swing of things.
And this is a liquid or a capsule?
Okay, so again, everything's liposomally delivered, so it's always a liquid. The smaller, the lower doses, like the 10,000, are a spray under the tongue, and starting at 100,000 and higher, I believe we have up to a 300,000 dosing now. Per bottle. Again, it's not per drop or anything, but per bottle. Those are actually drops that you place under the tongue because they're so concentrated. It's not going to aerosolize like a mist as well. So we put them as a drop, still liposomally delivered to that capillary bed under the tongue.
And how long a period of time do you recommend them take these for?
Usually we go for at least 3 months, but a lot of the patients like to just stay on it. So it actually makes them feel better. So
are there any contraindications?
Not that I've ever seen. Now, again, it is my professional opinion that the IGF1 product from Nutronics Labs does not cause cancer in of itself. But if there's any danger of a malignancy in your body, you should always get checked out by your physician before starting any kind of product like this. So again, that's the only caveat. A known.
So you would not use it if a patient has cancer, right?
I would be very cautious about it. I would speak with the oncologist because you can make arguments either way with it because it could actually maintain the rest of the body, even though it's in and of itself, it should not cause cancer because of the checks and balances that are within that growth matrix. Though you can make an argument to prevent sarcoplexy or the wasting away of the muscles and things like that of the body. If somebody's on chemo or whatever else, it can help to maintain them. But at the same time, the oncologist who's in charge should be the person that helps you to make that decision better. It really depends on the kind of cancer, how far a person's progressed. And, that really should be taken by a case-by-case basis if you actually do have a malignancy.
Okay. I think that's the end of the questions that I had prepared. Any other things you'd like to discuss with us?
Well, I mean, again, I just have nothing but praise for this product. The origin of the product, the founder of the company who's like my brother from another mother. He had a relative who had Lou Gehrig's disease, ALS, and he was going fast. And this product was quickly brought to him on an individual basis and it actually improved his quality of life. And unfortunately, the ALS still claimed him, but it improved his quality of life, and he lived quite a bit longer than was expected by his doctors. And that's what began this journey more than 30 years ago.
I wonder about benefits for brain function, such as in patients with dementia or Alzheimer's.
That's a really good question. There was a study at, I always get these mixed up. I think it's Cedars-Sinai in New York. Forgive me, I misquote the place, but it's one of the Sinai's. But they actually did a study on mice who were genetically made, essentially, kind of almost like
I think in New York it's Mount Sinai.
I thank you. You're right. My apologies, Mount Sinai. But the bottom line is that they gave these mice IGF2, which is in this product, and other neurotropins, which are also in this product. And they compared a group, and all these mice were genetically engineered to essentially have Alzheimer's, essentially, basically a diminishment of the brain. And so they put these mice in a random maze, and all of them initially couldn't do the maze. But eventually, the ones that were being fed the IGF2 and the neurotropins, they actually were starting to learn to follow the cheese in the maze. I mean, they're mostly successful, but not all of them found the cheese. And the mice that were given no enhancement with no IGF2 or neurotropins, no change at all. So basically, there is suggestive evidence there that it does help to improve long-term brain function. It helps to maintain neural pathways and things like that.
Yeah. And interestingly, Dr. Bredesen, who we recently had on the podcast, he often recommends hormone replacement for patients with Alzheimer's.
That's a really interesting take. And overall, I probably would agree with that. I think that when we lose our primary sex hormone, estrogen, females, testosterone in males, there is a significant change. And you can make arguments about where it comes from, blood flow, or from maintenance of other tissues, but there's a direct there's a correlation. I might not say a direct, but a correlation with the overall vitality of the brain and the ability to actually have better cognition. We here at our center, we do bioidentical hormone replacement. One of the big things we recommend ultimately is to do it through a pellet technology, meaning that there's basically consistent delivery of those hormones across a several month basis, because these things are actually implanted and they dissolve at a specific rate in your body. So one of the things that throws people off with hormones is that as you're trying to correct their hormones, again, we use nothing but bioidentical hormones, which have in every long-term study have shown no significant increased risk of malignancies, but if anything have been shown significant benefits. The bioidentical pellets being consistently delivered show a gradual increase of the person's benefits with elimination of specific symptoms, and they all do feel very well with this. And again, as compared to like saying taking a pill in the morning or night or using a cream, sometimes you'll feel better, but then it wears off and you go up and down with the thing. So the pellet technology, which is relatively new, is a thing we do here at our center. And again, the benefits of having more balanced hormones can very well play a role with increased vascularity, increased ability to maintain the tissues by having a generalized and more balanced hormone picture in your body.
Great. So let people listening know how they get in touch with you and how they can find out about this Deer Antler product.
So again, my name is Bruce Fong. I'm a DO, and I'm also in the Nevada, what's called a homeopathic medical doctor is my certification to use integrative medicine. My main clinic is Sierra Integrative Medical Center, and you can find us on the web at Sierra, SIERRA, integrative, INTEGRATIVE.com, all one word, no hyphens. And if you want to call us directly, we're at 775-828-5388. Again, that's 775-828-5388. And we've been talking about Neutronics Labs' ultimate and greatest product, the IGF1 Plus, which probably holds the greatest potential benefit for anybody who wants to healthy aging and to maintain themselves and be the best they can be. And you can find more information about these products at NutronicsLabs.com. That's Nutronics Labs, LABS.com. Again, no hyphens, just all one word. So again, please check out the product. And if you like what I've been saying, you want to come see me, please come see me. I promise you, I'll go through everything I can with you to help anything that you've got going on that you can't get answers for. So again, Ben, thank you so much for this opportunity to be on the show today.
And thank you, Dr. Fong. Thank you for making it all the way through this episode of the Rational Wellness Podcast. And if you enjoyed this podcast, please go to Apple Podcasts and give us a 5-star ratings and review. That way more people will be able to find this Rational Wellness Podcast when they're searching for health podcasts. And I wanted to let everybody know that I do now have a few openings for new nutritional consultations for patients at my Santa Monica Weitz Sports Chiropractic and Nutrition Clinic. So if you're interested, please call my office, 310-395-3111, and sign up for one of the few remaining slots for a comprehensive nutritional consultation with Dr. Ben Weitz. Thank you, and see you next week.